We put together the IDN and started looking at all these projects. We realized that once again, people were coming from various sites with variation in the amount of quality improvement or process improvement work that has been done. We've got lots of excellent silos in our IDNs, but our goal here is to create a system of learning and a system of excellence. So it doesn't make any difference when our patients or families touch us in one spot way up in the upper valley versus one spot down south near the border of Massachusetts. The system itself is a system of equal opportunity for excellence in care, no matter where you touch. To do that, we knew that we needed a group of people who could work across the different projects and could come with a set of skills to help us learn how to continuously improve and to continuously learn from each other. So the IDN, Region 1 IDN, has engaged the Citizens Health Initiative, and you all know Jeanne Ryer. She was here at our last IDN meeting. Jeanne and her team of coaches are helping to support all of our improvement work across the region. This gives them the opportunity to spread the great lessons that they've learned through their behavioral health integration work over the last couple of years. It also allows them to be the human dot connectors from one project to another, from one geography in our region to another. So I've asked Jeanne, and I think Jeanne's going to help, to introduce her team and to talk a little bit about how the team is going to help support our Region 1 activities. Jeanne,
Thanks, Sally. So I was in this room about last fall talking about our behavioral health integration learning collaborative. Many of you were here, and I want to do a quick introduction for those of you who don't know about the Citizens Health Initiative and the things that we're doing, introduce our team, and then Jeanne Thomas, who is our Director of Practice Transformation, is going to talk with you about the role that our practice facilitators are going to play across your project. So the Citizens Health Initiative is part of the Institute for Health Policy and Practice, and our offices are at the law school in Concord. We run a number of projects that span healthcare initiatives across the state of New Hampshire. Our Practice Transformation Network is funded by the Center for Medicare and Medicaid to help behavioral health, specialty, and primary care practices get ready for value-based payment by improving quality, improving patient and family engagement, reducing costs. We have nearly 1,000 individual clinicians enrolled in that project across all of those specialty areas, including about 20% of them are behavioral health providers, and that's really creating an interesting synergy for us with this work. We're entering our third year of our Behavioral Health Integration Learning Collaborative that has been working on sustainable practice and payment for integrated behavioral health in New Hampshire. We invite you to join us for that. And we invite you to join us next Wednesday, September 27th at the Camponi Center in Concord for our annual symposium, which will focus again on bringing value-based payment and behavioral health integration together. Our keynotes are Jay Want, who used to be in Colorado and is now at the Peterson Center for Healthcare, Steve Cassels, who is an expert in substance use disorder, and Yvonne Goldsberry, who will be helping motivate us all to action. We have also some excellent work breakouts for workshops and 6 hours of CME, CNEs, CEs, social work. We've got you all covered. So if you need some continuing education units, you should be coming down. It's also free. So sign up. We're not quite full yet. So if you all sign up, I think we can fit you all. But we have the Pediatric Improvement Project collaborating across the pediatric community, and our medical director, Sam House from Dartmouth-Hitchcock, working on a number of pediatric issues. And we work with rural health clinics. We've done some work with them with Rudy Fedrizzi and Cheshire's work on improving hypertension control, and we're now working on improving control of diabetes. So all of this is supported by an infrastructure of volunteer leadership advisory board and clinical committee, and we support it with both claims and clinical outcomes data from our participating practices. So that's who we are, what we do. It's a fun sandbox to play in, and we welcome all of you. So our team for this region, we pull staff from the Institute. We also have our own initiative staff. Usually I have them introduce themselves, but we don't have a lot of time. So I'm going to kind of do like the members of the band introduction. So on drums, we have Stephanie Cameron. She has the beat that keeps us all moving together in synchronicity. Kate Query, who's kind of competing engagement today, is best known for her graphic recording and facilitation skills, but she's also an expert in care transitions and person-centered planning. Marcy Doyle, again, who can't be here today, is our clinical quality and measurement person, so she'll be coming in on kind of SWAT team basis when you have measurement issues. Bill Hurd, who is newest to our team, is an expert in telehealth applications and a lean black belt. Molly O'Neill just is almost done with her MPH and has grad certification as in clinical microsystems, for those of you in that field. There's me. Jeanne Thomas has some number of years of clinical and practice operation experience, and she's also a fabulous trainer in leadership development and knows a lot about adult learning. And Scott Trudeau, who has a great background also in care transitions and in adult learning and development. So we have many things that we can bring to you, and our role is going to be to provide you with kind of the glue across your projects and to provide you with the tools that can help you all do your work, but also aggregate your work so that the IDN as a whole, as Sally has said, becomes a sum greater than the individual parts of the project. So Jeanne, you want to?
So just to continue from where Jeanne started, our philosophy is one of support and resource and being there for an expert for what you need. We know you're the experts in your content, you're the experts where you live, you know that part. And some of you also have quality improvement background, so we do not want to step on that. We look and ask you, where do you want us to help you do the work you're already doing? You know what needs to get fixed. We just want to help you. We're there to bring in resources, try different tools maybe you haven't used before. We believe in the all learn, all teach. You teach us as much usually as we can help you. So again, we're looking to pull out of you what you know, what you realize. You instinctively understand quality improvement, and we'll continue to tell you that. You do this all the time in your lives. We're just going to bring you the formalized side of it. We're going to be the nudges. That's the other thing. We're going to call, we're going to email, we're going to keep you on track. Hopefully that's going to help you not have to worry about that part. That's where this team is excellent about keeping things moving ahead. And again, aligning with what you do, many of our projects, the practice transformation project that I'm in, there's requirements for quality improvement work. The work you're doing in behavioral health integration with the IDNs fits right in with that. We're not going to create extra things at all here. We're there to help you make these projects move forward. So, I think Jeanne works with this microsystems. So facilitate team meetings. Our facilitators will be helping leaders with agendas if that's what they need, with minute taking, with keeping resources in places where you can find them, educating teams with tools. We're there and available for you. We're going to guide the process, work with you, facilitate, connect with Jess, with Dr. Mason, with Sally. Again, they'll be helping us saying, here's the high-level goals. We'll follow along where that direction is. Stephanie and her team are working on the site self-assessments and project planning templates. So some of you already are in that process where you did the site self-assessments. Some of you will just be coming into that. So any questions you have for us?
So if you currently have a project, you already have relationship with us. you have the new project, you will have a relationship with us. We're really eager to get going, and we do understand that many of you have, this is just the beginning, and there are many more of these projects to come in Region 1 IDN. So we're looking forward to working with all of you in some form or another. Your primary contact it will be Stephanie Cameron, our drummer, and me, and then we'll be assigning project facilitators to your projects as needed. And I think one of our goals, as Sally has stated, is to give you all the same set of tools so that you can aggregate your work and show progress for the quite significant investment that the state of New Hampshire and the federal government are making in you. We do actually have to kind of do this. This is like the dog that catches the bus. We have caught the bus, now we have to figure out what we're going to do with it, and we have to show outcomes and deliverables. And we're really excited to be part of this. I think those of you who were here last year know that I went to high school in this community. I graduated from Stevens High School in a year not to be named. I completed my graduate education at some institution up the road from here. I've lived in the Upper Valley, and I have a personal commitment, as do all of us, in helping this community be as healthy as it can be. So thank you for that.